As Charlotte continues to expand outward and upward, the pressure intensifies not only in the urban core but across Mecklenburg County, where rising land values reshape once affordable neighborhoods into investment corridors, and families who rented modest homes for years suddenly receive notices of redevelopment, forcing them to search for housing farther from jobs and schools, often into neighboring counties where transportation costs increase and community ties weaken. And this pattern reflects a national trend in fast-growing metropolitan areas across the United States, where housing supply has not kept pace with demand, and zoning codes originally designed for low-density suburban living limit the construction of duplexes, triplexes, and small apartment buildings that could provide more attainable options. So while cranes signal economic vitality, they also signal scarcity for those who cannot compete in bidding wars or meet stricter rental screening criteria. In Charlotte, stories of displacement are often quiet, unfolding apartment by apartment, as landlords renovate older complexes and rebrand them at higher price points, a process sometimes called value-add investing, which may improve aesthetics but also removes naturally occurring affordable housing from the market, leaving tenants with few alternatives. And for individuals already on the financial edge, application fees, security deposits, and background checks become barriers that compound hardship, especially for those with prior evictions or criminal records, even when those records stem from survival behaviors during previous episodes of homelessness. Outreach advocates describe how quickly a person can move from stability to crisis, noting that many households live paycheck to paycheck, and when rent consumes more than 30 or 40% of income, any disruption can trigger a cascade of consequences: missed payments, late fees, eviction filings, damaged credit, job instability, and eventually homelessness, illustrating how housing insecurity exists on a spectrum rather than as a single event. And in Charlotte's encampments, some residents previously worked in the city's hospitality sector, construction industry, or service economy, sectors that often offer limited benefits and fluctuating hours. And while the city's unemployment rate may appear low during periods of growth, underemployment and wage stagnation remain persistent challenges that undermine long-term housing security. At the same time, public schools in areas with rising property values often benefit from stronger tax bases, while schools serving lower-income neighborhoods face greater strain, reinforcing cycles of inequality that affect children experiencing homelessness, who may struggle with attendance, concentration, and emotional stress as they move between temporary living arrangements. And educators across Charlotte report that housing instability is one of the most significant hidden barriers to academic success. Yet federal protections such as the McKinney-Vento Act provide only partial relief, as transportation logistics and limited shelter space complicate consistent enrollment. Healthcare systems also feel the impact, because individuals without stable housing are more likely to rely on emergency rooms for care, increasing public costs while failing to address root causes. And studies consistently demonstrate that providing permanent supportive housing can reduce overall expenditures by decreasing hospital visits and interactions with the criminal justice system, reinforcing the idea that housing is not merely a commodity, but a form of infrastructure essential to community well-being. Within Charlotte's civic landscape, debates continue over how best to deploy housing trust funds, whether to incentivize inclusionary zoning policies, and how to balance market-rate development with affordability requirements. And while some argue that increasing overall supply will eventually moderate prices, others emphasize that deeply affordable units require direct subsidies, because market forces alone rarely produce housing accessible to extremely low-income residents, especially those earning below 30% of area median income. And this tension shapes budget priorities and long-term planning strategies. Meanwhile, faith-based groups, nonprofit coalitions, and grassroots organizers collaborate to provide meal services, job training, and transitional housing, recognizing that preventing homelessness is often more cost-effective and humane than responding after it occurs. Yet prevention requires robust rental assistance programs and legal support for tenants facing eviction, as eviction filings can appear on public records even when cases are dismissed, limiting future housing opportunities. And Charlotte's legal aid organizations report that representation dramatically reduces the likelihood of displacement, highlighting the role of policy in altering individual trajectories. As climate patterns shift, extreme heat and severe storms add another layer of vulnerability for unsheltered residents who face heightened health risks during summer months in the Southeast, and emergency response plans must account for these realities, further illustrating how homelessness intersects with environmental resilience planning. At the regional level, transportation access influences housing affordability, because households pushed farther from the city center may find lower rents but incur higher commuting costs, effectively offsetting savings. And Charlotte's expanding transit infrastructure offers opportunities for transit-oriented development that integrates affordable units near job centers. Yet such projects require sustained political will and community engagement to succeed. Beyond statistics, personal narratives continue to reveal complexity, as some individuals describe cycles of hope and setback, securing short-term employment or temporary housing only to lose stability due to medical bills or family crises. And these stories challenge simplistic assumptions about homelessness, emphasizing that it is often a symptom of broader systemic imbalances rather than isolated personal shortcomings. Charlotte's identity as a thriving southern city with a growing skyline and diverse population stands at a crossroads, where decisions about land use, wages, tenant protections, and public investment will determine whether rising home values translate into inclusive prosperity or deepen disparities. And as policymakers, residents, and advocates confront these realities, the central question remains whether economic growth can be intentionally guided to ensure that teachers, healthcare aides, construction workers, retail employees, and service staff, the very people who sustain the city's daily life, can afford to live within it. Because without that balance, the distance between the housed and unhoused will continue to widen, making homelessness not an anomaly but a predictable outcome of unchecked housing inflation. And the future of Charlotte depends on recognizing that stable housing is foundational not only to individual dignity, but to the long-term resilience and equity of the entire community. The conversation about housing cannot end with statistics alone, because the lived experience behind every number reveals a deeper structural story unfolding block by block, where new townhomes sell for prices unimaginable a generation ago, while, only a few miles away, families line up before dawn hoping for a shelter bed. And as development continues to reshape corridors along Central Avenue, Wilkinson Boulevard, and North Tryon Street, the economic divide becomes less abstract and more visible, reflected in the contrast between luxury rooftop pools and tents tucked behind tree lines. The median home value, once considered affordable compared to larger metropolitan areas, has steadily increased over the past decade, fueled by corporate relocations, population growth, limited housing inventory, and investor activity. And although rising property values generate wealth for homeowners and expand the city's tax base, they also intensify rental pressures, because landlords adjust pricing in response to market demand, pushing monthly rents higher and narrowing options for residents earning hourly wages, disability income, or fixed retirement benefits. And when rent exceeds a manageable share of income, even small emergencies, medical bills, car repairs, reduced work hours, can unravel financial stability, leading to eviction filings that permanently mark rental histories and make securing new housing even more difficult. Outreach workers across Charlotte describe a shifting demographic within the homeless population, noting increases in seniors who cannot keep pace with property tax hikes after neighborhoods gentrify, working parents juggling multiple service sector jobs without benefits, and young adults burdened by student debt, yet unable to save for deposits as rents outpace wage growth. And while some individuals experience short-term homelessness before stabilizing through rapid rehousing programs, others fall into chronic homelessness compounded by untreated mental health conditions, substance use disorders, or histories of incarceration that limit employment opportunities, revealing how housing insecurity intersects with healthcare access, criminal justice policy, and labor market dynamics. The city's shelter network, supported by nonprofit organizations and faith communities, strives to provide emergency relief. Yet capacity constraints mean that not everyone seeking assistance receives immediate placement, particularly during winter cold snaps or summer heat waves common in the Southeast. And unsheltered residents face heightened health risks from extreme weather, exposure, and limited sanitation facilities, underscoring the urgency of coordinated public health responses that recognize housing as preventive medicine rather than solely a social service concern. At the policy level, Charlotte officials debate land use reforms aimed at increasing density near transit lines, encouraging mixed-income developments, and expanding housing trust funds to subsidize units affordable to households earning below area median income. But such reforms often encounter resistance from residents concerned about neighborhood character or traffic congestion, illustrating the tension between preserving existing community aesthetics and addressing urgent affordability needs. And this dynamic reflects broader American patterns in which cities experiencing growth must reconcile market-driven development with equitable access to housing. Transportation infrastructure further complicates the equation, because families pushed to outer suburbs may find slightly lower rents but incur higher commuting costs and longer travel times, reducing disposable income and limiting access to urban job centers. And as Charlotte continues investing in transit expansion, the opportunity exists to align transit-oriented development with affordability requirements so that economic mobility is not restricted by geography. Education systems also feel the ripple effects of housing instability, as children who move frequently between temporary accommodations struggle to maintain consistent attendance and academic progress, and teachers report increased behavioral and emotional stress among students facing eviction or shelter living, reinforcing the idea that stable housing is foundational not only to individual well-being, but to long-term community outcomes. Meanwhile, data consistently demonstrates that permanent supportive housing models, combining rental assistance with case management, reduce public expenditures on emergency health care and incarceration, suggesting that proactive investment yields measurable returns. Yet scaling such programs requires sustained political will and cross-sector collaboration among government agencies, philanthropic partners, and private developers. As Charlotte's skyline continues to evolve, with cranes signaling new corporate offices and residential towers, the city stands at a crossroads, confronting whether its growth will prioritize inclusivity or allow widening disparities to persist. And the broader national housing shortage places additional strain on local solutions, because supply chain constraints, rising construction costs, and interest rate fluctuations influence development feasibility, often making deeply affordable projects financially challenging without layered subsidies. Community advocates emphasize prevention strategies such as rental assistance, eviction diversion programs, and legal representation for tenants, noting that preventing displacement costs far less than addressing homelessness after it occurs. And some pilot programs demonstrate promising reductions in eviction judgments when tenants receive counsel, highlighting how targeted interventions can alter trajectories. Beyond economics, there is a human dimension defined by dignity and belonging, as individuals experiencing homelessness often describe feelings of invisibility within a city celebrated for prosperity. Yet many express aspirations similar to any resident: stable employment, safe housing, and the opportunity to contribute meaningfully to their community. And their resilience challenges stereotypes that oversimplify homelessness as a personal failing rather than a structural imbalance. Charlotte's identity as a financial hub and rapidly expanding southern metropolis carries both opportunity and responsibility, because the same growth attracting investment also increases competition for land and housing. And without intentional inclusionary policies, market forces alone may continue pricing out essential workers, nurses, teachers, hospitality staff, whose labor sustains the city's daily operations, ultimately threatening long-term economic stability if workforce housing remains inaccessible. Looking ahead, the path forward likely requires a multifaceted approach. Zoning modernization to permit diverse housing types, expanded public-private partnerships to finance affordable developments, strengthened tenant protections to reduce displacement, workforce development initiatives to increase income stability, and comprehensive supportive services addressing mental health and addiction, all guided by data transparency and community engagement to ensure accountability. In this evolving landscape, the central question persists: can Charlotte align its remarkable growth with a commitment to housing equity, ensuring that rising home values do not translate into rising homelessness, but instead fund solutions that extend opportunity across income levels? And the answer will depend on sustained collaboration, evidence-based policymaking, and a collective recognition that housing is more than an asset class. It is the foundation upon which health, education, employment, and civic participation rest. And as Charlotte continues shaping its future, the choices made today will determine whether prosperity becomes broadly shared or increasingly concentrated, defining not only the skyline but the lived experience of every resident who calls the city home.